Department of Health says the number of measles cases in the country are rising. COVID-19 infections, we're told, having now stabilised. With the festive season in full swing, the department says various campaigns are being implemented across the country to ensure that there's no disruption to services. Let's get you a sense of how the health department is preparing for the next few weeks. Deputy Health Minister Dr Sibongiseni Dhlomo joins us via our video link this morning. Dr Dhlomo, great to see you as always. Thanks for coming on, giving us a sense of how you plan to stabilise measles cases, which I understand are on the rise in the country.
Good morning, ma'am, and good morning to your viewers. Thank you very much. Yesterday we had a MINMEC, or what we call the National Health Council, where the minister meets with all other provincial MECs of health, just to map a way forward, update and check how are we doing. But among other things, you are correct. What was topical in that meeting was actually the measles outbreak. According to the WHO, once we have 3 cases of measles in a specific defined district, then that is defined as an outbreak. So you would then know that we have an outbreak in Limpopo, Mpumalanga, Northwest and Gauteng. So 4 out of 9 of our districts have been affected. We are talking about 137 cases that have really since been found. Of those that are spread mainly between Limpopo, about 94 cases and 40 in Mpumalanga. So we then met and therefore agreed that we will have to roll out the vaccinations, because it's mainly affecting the 5 to 9-year-old children in the country. Therefore, we don't want to spread, because this is a disease that can spread by contact. And therefore, as we are going to have a lot of South Africans moving out of cities, going to the rural areas, we will be having and piggybacking on the Arrive Alive campaign, sort of vehicles and stations on the road, mainly the major national roads. If you do find and you have a desire to have a child vaccinated, please let's get them vaccinated, because of the 137 cases that we do have already in the country, 94 of them have no vaccination status. Only 17 had been vaccinated before, and 22 were not vaccinated. So it means probably the whole of that 94 with an unknown status of vaccination were not vaccinated. So we are calling upon our South Africans to really take an advantage of where we are going to be found on the roadsides, in the clinics, to vaccinate, so that we don't really spread this countrywide and get this measles contained.
Yeah. Dr. Dhlomo, you and I have spoken about this before, haven't we, about increasing calls for people to get out there, check their vaccination status, and if it's found that they've never received a measles vaccine, to go ahead and do that, because it is that easy, right? Have you seen an uptick in people going and getting their vaccines?
Look, majority of our this issue of vaccination has always been with us. Now, it's just that maybe because of the other pressures, we have been focusing on other pressures, COVID-19, and therefore poor access to our facilities for other things. Maybe that's been a window that has come in there. But we are very confident, because South Africans have always been, especially for children, have always been focusing on vaccinations. So we are just calling upon, because yes, especially if you are a child who is malnourished, this disease can actually complicate and get to death. But we would really wish that a lot of parents will heed to the call, and we would really hope that they will really take the advantage of now a school break and children are all around them at home, to take an advantage, to take them to facilities and to all other areas where we'll be opening up areas along the roadsides for vaccinations. It's going to be just a very small little time that we need from you to just go there and get vaccinated. There's a huge benefit if we do vaccinate our children.
Well, let's stay on the issue of vaccines, Dr. Dhlomo. Insofar as COVID-19 is concerned, analysts were telling us over the past few weeks that we did see a spike in new infections, although hospitalizations and deaths, of course, are not as high as previous parts of the pandemic. Has that now slowed down? How would you describe the current place we are in the pandemic?
On the COVID-19, we could report that as of the report we got yesterday, we have used 38 million doses of the vaccines to date, and that's a very good measure for South Africans. We continue saying the disease is really now stabilized. We don't have high cases. We probably here and there do have some cases of COVID-19, but severe death, not at all. It's been reduced significantly. We are, however, calling off all our South Africans, probably because there is a significant number of us who are vaccinated, especially if we want to commend the 50 and 60-year-olds who are vaccinated up to 70%. We really want to commend them and thank them a lot and say to the younger ones, let's continue vaccinations because there is a merit in that, getting boosters again, because you are then much more protected. We don't have any upsurge of any Omicron or any COVID-19 for now, but in the event it comes in next month and next year, let's us be ready with vaccination. So we don't have any flaring episodes here and there. There are certain pockets of some little fires there, but they are not really many worrying us, especially if they would come to any community that is vaccinated. I might as well add something that is new that we brought up yesterday by the minister, that as of next year, we have been vaccinating 12 years and above. So next year we'll start with a 5-year-old to 11-year-old, especially those who are children with immunosuppressed, with certain diseases like cardiac, kidney, and other diseases that are really pressurizing the children as they grow. So we have been given that window by the scientists. Otherwise, we have not been vaccinating up to now, but that will start next year.
Well, we're in the festive season, and thanks for that update, Dr. Dhlomo. But part of the discussion this morning with you is also about how your department plans to deal with just capacity insofar as the challenges that this time of year does bring.
In terms of the festive season challenges, you probably know that there is a very strong campaign in our country, Arrive Alive, led by Department of Transport, where they are very visible on the road, actually reminding us to drive slowly, to drive within the speed limit, really get a regular rest. We therefore piggyback on those campaigns with our emergency medical services vehicles, so that whenever there's a misfortune, an accident, we are not very far to be picked up. So yesterday we got a plan. All provinces have got contingency plan of their emergency medical services, at which spot they will be ready to actually assist our South Africans in the event they get into accidents. All major routes will be visible there to give the support, but we still wish to really request South Africans, among the things that people just get involved in road accidents, probably they didn't even check themselves. I mean, I might be a driver, I haven't checked my high blood pressure, my diabetes, and I don't know that I'm actually having those challenges. So let's do those regular checks and also get the regular stops. But we'll be visibly supporting the Road Arrive Alive campaign, and they will have our vehicles. Our thanks so much to our healthcare workers who will probably forego the Christmas and the festive season and be there. We do have to do this because there's going to be a high volume of vehicles on the road. So visibility of the police, ourselves as the emergency medical services, is also critical.
Several moving parts to that story. Dr. Sibongiseni Dhlomo, Deputy Health Minister, let me thank you for your time this morning. Measles, COVID-19, and of course the usual advice insofar as our behavior, you and I,